Hi everyone, this is Dr. Pasunuti Sumanth, consultant pediatrician. As many parents are worried about their newborn baby snoring and are not able to decide whether it's normal or abnormal. So, for those parents, here is a video explaining everything about newborn snoring. Newborns often have noisy breathing, especially when they are sleeping. This breathing can sound like snoring and may even be snoring. Remember, in most cases, these noises are not a sign of something dangerous. The nasal passages of newborns are very small, so the least bit of dryness or extra mucus in their noses can make them snore or have noisy breathing. Sometimes, what sounds like snoring is just how they breathe as a newborn. As they grow, a newborn's breathing typically gets quieter. However, if your baby starts snoring and has other symptoms too, you want to make sure that those noises are not an indication of something more serious. Now, we'll see the possible causes of snoring in babies. The more common cause is a stuffy nose. If that's the case, nasal blockages can be cleared up by using saline drops. As babies grow, the size of their nostrils increases and the problem of snoring usually subsides with age. However, snoring can occasionally indicate more serious issues. If your baby's snoring continues and worsens after using saline drops, please record the sounds with a camera to play them for the pediatrician. Now, we'll see the other causes of snoring. Loud snoring can be a sign of many things, including enlarged tonsils or adenites, deviated nasal septum, or even sleep apnea. Even though snoring is just our body making a sound, it's usually a symptom of a greater issue, and all of the possible issues make it harder for children to breathe and get quality sleep. A deviated nasal septum may be a relatively common occurrence in the first days after birth, appearing in nearly 20% according to one study. Many of these babies have no symptoms from this, though, and it may resolve with time. However, other causes of snoring are more likely to appear in older children than in babies. Though many children snore, only 1 to 3% of children experience sleep apnea, and the chances are they are between the age of 3 and 6 years. Now, we'll see another important cause of snoring, that is laryngomalacia. This condition causes a softening of the tissues of the voice box or larynx. In this condition, the laryngeal structure is malformed and floppy, which causes the tissues to fall over the airway opening and partially block it. 90% of the children will see their symptoms resolve without any treatment, and this condition usually goes away on its own by 18 to 20 months of age. For very few babies with severe laryngomalacia that interferes with breathing or eating, a breathing tube can be used or a reconstructive surgery can be performed. Now, we'll see the consequences of improper sleep due to snoring. Children who habitually snore may not be getting proper deep waves of sleep if they also have sleep apnea. Their bodies may wake them up due to labored breathing and the buildup of carbon dioxide within the partially collapsed or blocked airways. Not only is labored breathing noisy, but it impedes proper sleep, causing additional problems. Sleep deprivation can be detrimental to growth and development. It can also be even associated with poor weight gain, behavior resembling attention deficit hyperactivity disorder, bedwetting, night terrors, obesity. Any child with the following symptoms should be fully evaluated by the pediatrician: having a hard time sleeping at night, having difficulty breathing during the day, having a difficult time eating and gaining weight, snoring with long pauses between breaths. Now we'll see regarding the sleep testing and other screening methods. While sleep tests are usually recommended for older children, it's a procedure that could be necessary if a child has abnormal snoring issues that begin in infancy. Other medical screenings for snoring babies and children may include endoscopic exams to provide direct view of the airway, pulmonary function tests to evaluate the lungs, CT scan, MRI test, voice and swallowing screenings. Final takeaway message of this video is snoring in babies is rarely the result of a serious medical condition. Stuffy noses, the most common cause of snoring, can be managed with simple home remedies and may not need any treatment at all. If your baby is diagnosed with a deviated nasal septum or laryngomalacia, remember these may also not require any treatment. However, if you are concerned about your child snoring or breathing, please do visit your pediatrician. Hope I have explained everything in detail about newborn snoring, and if you have any further queries, please do ask us in the comment section. And thanks for watching.